Dr. Esselstyn, I guess the question for you is, where do you stand today in terms of fat? Many very respected whole food plant-based authors continue to say that there are benefits to avocados, raw seeds, raw nuts, and raw olives. And in some cases, they say there's also benefits to oils such as hemp, flax, walnut oil. And many of them, claim over and over that there are significant benefits. And that even if your studies worked without using these nuts, they're saying that they might have also worked just as well if you had used avocados, seeds, nuts, and olives. That's your question. Dr. Campbell, your question is, what is the impact of nutrition on preventing prostate cancer? Does that specifically, have you seen studies showing that lifestyle and diet affects prostate cancer? Dr. Montgomery, your question is, does a whole food plant-based diet automatically bring your cholesterol level down to a healthy level? Do we want our cholesterol below 150? And then also, does a whole food plant-based diet, in your experience, prevent against all heart attacks and strokes? Dr. Lee, Professor Thomas Seyfried says that glucose and glutamine feed cancer. Does this mean that we should avoid all fruit since it has fructose in it? And how can you avoid glutamine? Also, should we try water fast and green juice fasts to help beat cancer? So if we could go in order, I guess Dr. Campbell, Dr. Montgomery, Dr. Esselstyn, and then Dr. Lee.
Can you repeat that quickly, Steve?
Yes. Does a whole food plant-based diet and lifestyle prevent prostate cancer?
Yeah. Two studies come to mind. One by Ed Giovannucci at Harvard some years ago, and he was able to show a really impressive relationship between the consumption of skim milk, of all things, and prostate cancer risk. That was a very impressive thing. Some others have followed up on that same idea. The other study that I have in mind is Dean Ornish, that Dr. Esselstyn referred to before, that were able to show some benefits from, and prostate cancer going on to, take the blood cells out, see what's in blood cells and that sort of thing. Prostate cancer behaves in a rather similar way to some of the other reproductive cancers, at least epidemiologically. And dairy seemed to come into play, on that one as much as anything else. And so, prostate cancer is just one of them that's going to behave, in my view, just about the same as heart disease and many of the other cancers as well. Nothing special about it.
Thank you. Dr. Montgomery?
I'm sorry. The question is, I'm gonna repeat it, make sure I have it right. Does a whole food plant-based diet prevent heart attack and stroke totally? And what was the other part of that? Can you remind me of that?
And does a whole food plant-based diet automatically bring your cholesterol level to a healthy level or below 150? And do we want our cholesterol level below 150?
Okay, great set of questions. One thing, I remember taking standardized questions, and whenever you ask these, foils that have absolutes, you tend to avoid the absolutes, and I'm going to avoid the absolutes. And here's what I'll say. A whole food plant-based diet is at the core of a healthy lifestyle, but there are many aspects of a healthy lifestyle. The reason we started for a long time putting emphasis only in whole food plant-based diet. And oftentimes, patients would say, well, what about exercise and all of this? I think those things are important. But what I found with the nutrition part is that people were addicted to bad foods. And so, we get in, so eat a healthy, diet and plant-based, et cetera. And if they get me off in the trail of exercise and proper sleep, they'll come back the next week and say, I'm exercising more, I'm still eating cheeseburgers, but I'm exercising more and sleeping better, whatever the case may be. So we really got at the core of what people were addicted to, first and foremost. So what we have found in our practice is that there's a big part of heart disease reversal, heart disease and stroke prevention in plant-based diet. However, there are many other aspects of our lifestyle that can have an impact on these disease states, excuse me, such as stress, lack of sleep, and various other things. Now, once someone's on a very healthy diet, they tend to tolerate stressful events, situations better. They tend to sleep better initially. So once you change your internal biochemistry, you tend to perform better in these other areas. You're more able to exercise and the like. So starting at that core is very, very important. So I would say my answer is that a large percentage of heart disease would be treated, heart attacks and the like. But I'm going to leave a little bit of extra for someone who's doing something crazy that could make it extreme, such as smoking a lot despite eating a whole food plant-based diet, or drinking too much, as Dr. Lee pointed out earlier, that could have an adverse effect on the heart, or doing other things. And oftentimes patients will come in and say, I'm eating a whole food plant-based diet, and I don't know what that means. Are you microwaving all your food? Or are you grilling all of your food? Maybe you're not having oil, but you're eating processed foods out of a can that has chemical preservatives and the like. And if you're trying to reverse a chronic illness, you have to be much more pristine with the diet than that. And so I will say no, in the sense that the whole food plant-based diet, I want to make sure I know what they're eating. So I don't want your audience to walk away saying, okay, I'm eating a whole food plant-based diet, but they're eating chemicalized foods or packaged foods and things like that. I don't think that's what we mean when we talk about whole food plant-based, but everyone may not carry that level of understanding with them. And there's always a residual case for someone having a problem. To the cholesterol issue, again, elevated cholesterol, as I see it, is a metabolic problem. It isn't just a problem with eating too much fat and cholesterol. I've had patients who are eating a plant-based diet, their cholesterol is elevated, and we'll make changes in their diet related to how they prepare the food, and the cholesterol comes down. We'll make changes in their diet in terms of being able to wean a medication or two, and the cholesterol come down. I've had patients on a certain medication have adverse liver effects, and we take them off that medication, the cholesterol come down. So I see elevated cholesterol more of a complex issue than what we really know. Yes, removing animal protein and animal fats from the diet can bring the cholesterol down. But consumption of animal protein, animal fats, animal protein consumption brings many more toxins into our system than just the fats from the animal. And so the chemical preservatives, the antibiotics, does it have an effect on the microbiome? So there are many complex, multidimensional problems that we have when we consume animal protein and other processed foods in our processed diet that can have an adverse effect on our liver, such that, cholesterol metabolism can be impaired. So a whole food plant-based diet, yes, will bring the cholesterol down in the vast majority of people because you're removing one of the major toxic sources. But I have to leave room for that a small percentage of people who may be on a certain medication or some other substance that they're consuming, whether it's a supplement or whether the like, that's having an adverse effect on liver metabolism that may be elevating the cholesterol, and we have to address that problem as well. Regarding the cholesterol level of 150, this is a question that came up in my presentation earlier related to cholesterol level 180. I really like to treat patients in totality and not just numbers. By that, I mean this. We can look at a study and show that, yeah, people with a total cholesterol level below 150 are heart attack proof. However, I may have an individual with a cholesterol level that is say 190, but maybe they have familial hypercholesterolemia and they used to have a total cholesterol of 400. I've had that happen. And so they're doing a lot of positive things lifestyle-wise, whole food plant-based diet, exercise. We've reduced a lot of the medications and the like. And so I may not add another drug or supplement just to get that number down. I will follow that patient over time and look at the totality of that patient in terms of their risk factor. What is their inflammatory markers? What is their unstable plaque risk score, and various other things, the troponin level, how much myocardial stress is happening. So I look at a lot of biochemical parameters in the totality to make sure that this patient is going in the right direction, because one number does not tell the whole story, and it's only a part of the biochemical, the complex biochemical process.
Thank you. Dr. Esselstyn.
Yeah.
Can I add one comment on that low cholesterol question? Because when we did the China study now, we're raising 40 years ago almost, At that particular time, there was some really kind of very weak evidence that supposedly people with less than 150 had a higher rate of colon cancer for one. And there was one study suggested that, wasn't convincing. Another one, of all things, a higher rate of suicides, which is kind of crazy. And so the idea got out there that going below 150, I remember in those days, was suggested as not being wise. When we started to get our data from rural China, and this is for 6,500 people, quite frankly, it's a good sized number. We saw cholesterol levels more than half being below 150 by far, 2/3. I was worried about it a bit. We went back then, as a result, went to 2 more labs to reanalyze those samples, got the same results. So at the end of the day, what we had a range, there's a range of means for villages in this particular case. It went from about 88 to 170, 88 to 170. The mean was 127. And so here's 2/3 of that particular population, actually with the low cholesterol levels, rarely seen any heart disease that Dr. Esselstyn referred to before, to some of the data he happens to have seen. So as far as low cholesterol levels are concerned, from an epidemiological point of view and some other considerations, I don't think that's a problem. I think it's overstated. That was an old issue once rumored to be a problem, but I don't think it's true.
Thank you.
Just to follow up on Baxter's comments, I would agree that no number has ever caused heart disease. And I try to tell the patients that what is causing their heart disease is any morsel that they eat that has the capacity to injure their endothelial production of nitric oxide. And that, I think, is because everybody has a different thermostat in their liver, and they're going to make either the cholesterol below 150 when they're eating this way, or it may be 180, 190, or 200. But they're not going to have heart disease unless they're injuring their endothelial production of nitric oxide. Now, I was asked to make a comment about nuts and avocado. And first of all, fat is absolutely essential in the diet. And in the foods we ask patients to eat, they're going to eat all these marvelous whole grains, plenty of fat. They're going to have all these marvelous legumes, lentils, and beans, 101 different types of legumes, as I mentioned, plus red, yellow, and green leafy vegetables, white potatoes, sweet potatoes, and some fruit. They're not going to be at all fat deficient. The fat that we do take away is usually the fat that is associated with injury to the endothelium. So I don't like them to have any oil. I wrote a paper that was published in 2019 in the Journal of Disease Reversal and Prevention on on oil. And it says, is oil healthy? And I went over the animal studies and the human studies, how the oil injures endothelial cells. Now, nuts and avocado. Yes, in my book on page 69, it says very clearly, patients who do not have heart disease, I don't have any problem with their having nuts. Once they have heart disease, I feel that if you then give them the green light, nuts are so addicting that if they ever hear Dr. Esselstyn say it's okay to have a few nuts if you've got heart disease, what you're going to have is this. You're going to have, there'll be nuts in the glove compartment. They'll be in the bathroom, the bedroom, the kitchen, the workbench. They'll be all over. They are highly addicting, and that's a lot of saturated fat that I don't want. And the same is what, maybe I was a little tough on the avocado as well. But having a program that is designed so that we do not at any time injure the endothelium has really given us, I think, results that we are happy to compete with anybody on the planet. Whether you want to look at our angiograms, whether you want to look at our pulse volume studies, whether you want to look at the reversal of the PET rubidium dipyridamole scan, it's been very exciting and very successful. Now, the other conflict that I feel is a little bit in a lot of these oil studies is the following. If you look carefully in the authors, so often they seem to have relationship to the oil industry or to the nut industry. And the late Arnold Relman, who was an editor of the New England Journal, has felt that that kind of association is absolutely inexcusable. Now, the other thing that is a little bit problematic for me when people go a little bit crazy on nuts, I have yet to find a single study in the literature where you take patients who are seriously ill with heart disease, give them all the nuts they want, and have the disease halt or reverse. The study that I do know about is Predimed. And Predimed had three groups. They had Mediterranean diet with oil, Mediterranean diet with nuts, then the so-called low-fat diet. Now, to be a requirement to be part of that study was that you could not have a history of any cardiovascular disease because you were entered into the study. But lo and behold, what happened after 5 years? In the study with Mediterranean diet with nuts, 93 major cardiovascular events, heart disease, stroke, and death, and 96 events, and those with the Mediterranean diet with oil, and then 109 in those who had the low-fat diet. So really, adding nuts to this group that didn't have heart disease didn't turn out very well. And I think that in the interest of time, I'll wrap it up at that point, except to say that I again will invite anybody who wants to look at our long-term study on, was in 2014 Journal of Family Practice. We looked at those 200 patients, and 177 who were compliant had one further cardiac event over 4 years. The 21 patients who were not compliant, 62% had events in follow-up. Thank you.
Dr. Lee?
Could you repeat the question again?
Yes. Professor Thomas Seyfried said that glucose and glutamine feed cancer. Does this mean we should avoid all fruit since it has fructose in it? And how can you avoid glutamine? Also, do you have any knowledge or experience about water fast, green juice fast? Do either of them help to fight or beat cancer?
Let me answer the last one first. I don't have any experience with green juice and cancer treatment, so I don't have anything to say about that. The question about Thomas Seyfried's studies looking at glucose and glutamine, it is true actually that cancer cells seem to thrive when you introduce glucose to them. It is also true that studies have been done looking at the correlation of blood glucose and cancer progression and aggressiveness. And so I think that the body of evidence that's out there now with research does show that hyperglycemia actually is a risk factor for a poor outcome in the treatment, in sort of the status for a cancer patient. About the issue about fruit is more complicated than simply having sugar or not having sugar. You know, the fact of the matter is that most fruits have a lot of other things besides fructose, and not all fruits have the same amount of fructose. And so, like everything in life, you know, it's sort of about trade-offs. It's true that you can actually you can avoid fruits if you like and go straight to a vegan diet. But I can tell you that so far, cancer patients who go on vegan diets still die. So that's also not a magic bullet, silver bullet approach. They still die of their disease. So I think that we don't have the definitive answer of how to actually use cancer for diet, but clearly having more foods, plant-based foods with bioactives that can actually activate bodily defenses that actually fight cancer have been beneficial, and including there are studies that correlate the consumption of certain fruits as well to improve cancer outcomes, lower risk of cancer as well. And I think Dr. Montgomery actually said it really well, which is every patient needs to be treated in their own individual situation. So it's really difficult to kind of hand wave and create a generic policy or best practice for every cancer patient. So I guess how I would sum that up is to say, fruits have a lot of other things that can be beneficial to fight cancer besides fructose, which might not be that great for cancer. And so it's not really clear that cancer patients should avoid all fruits. And in fact, there are some studies that actually show fruits to be beneficial. A great example of a fruit that's been beneficial, in fact, is tomatoes. Tomato is actually a fruit, and it's been shown to have some benefits for people that consume them for lowering the risk of prostate cancer.
Thank you. If you would each take a minute and a half to make a final closing statement on anything you want to leave us with or wrap up with, or any final thoughts at all.
Yeah, Dr. Esselstyn, I would like to say that, first of all, I want to say thank you again for the opportunity to be with such distinguished colleagues and friends. And again, to congratulate you to Steve for really putting together this really wonderful symposium, and think of the information that you have shared with so many who are listening to what you have to say. I would just wrap it up by saying that I guess the reason that I find myself 21 years since retiring from surgery as passionate as ever about cardiovascular disease, and actually what I really see as the seismic revolution in health that is on the horizon. And that seismic revolution in health that is on the horizon is never going to come about through the invention of another pill, another procedure, or another operation. But the seismic revolution in health will come about when we in the profession have the absolute will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to absolutely annihilate chronic illness. Thank you.
Can I jump in here to be next one? Because I think what Dr. Esselstyn just said is perfect, absolutely perfect. I totally support what you just said, and I'm sure the colleagues would agree with that. But I would add the additional comment too, having been in nutrition all these years, that's one topic that's not even considered by most people to be a medical science. It's time that needs to stop. We got 27 institutes at NIH, for example, devoted to various and sundry specialty health problems. Not one is called the Institute of Nutrition. There's been discussion here in just the last 6 months or so that there's a new nutrition program, so it is said. Some advertisement of that is in the press. Quite frankly, it's been tucked away in the director's office. And the director of NIH at this particular point in time, this was done once before and it failed. The director in this particular case is a geneticist, a very famed, very qualified, reputable geneticist. And so when we take a nutrition program, tuck it into a budget to compete with genetics is not going to work. It's going to fail. So I think we need to take this science, respect it, do something about making sure that the public get informed. Just as Dr. Esselstyn just said, it's critical.
Thank you.
Well, I'll jump in here. And again, thanks, Steve, for having a great program, of course, and then thanks for inviting me again. I always learn a lot, and I watch your programs online as well. So I get a lot out of these conferences. And again, thanks to each of my esteemed colleagues. I've learned a lot on this panel, Dr. Lee, Dr. Campbell, Dr. Esselstyn. Thanks for your kind words and insight. My comment is to the general public. We're in a healthcare crisis, and I want to commend everybody who's attending here, everybody who's going to pass this information on, because our healthcare crisis is going to be solved by us at the grassroots level. And I see this as a grassroots approach to this problem. Each individual is going to be empowered with knowledge that they're going to walk away with from this conference. They're going to pass that information on. And from the grassroots up, we're going to make these changes. We're going to make demands on our commercial industries to provide better food. We're going to find our own better food. We're going to plant gardens in the backyard, and we're going to do things that are more natural. It's, food is a big part of the issue, but getting outdoors, more green spaces, more fresh air and sunshine, removing more toxins from our system. These are the issues that we have to address individually and collectively. And so, as I often have stated over the years to individuals in my boot camp classes and the like, I think this is a movement, and I'm recruiting everybody who's within earshot of this to join the movement, pass on whatever knowledge that you've obtained from this conference, because together we're going to have to take this and move this information forward. It's not a top-down process, it's a bottom-up process, and it starts right here in meetings and conferences like this.
Thank you.
And I guess I'll close out with my comments to first thank my fellow panelists, who I always enjoy being in the company of people that stimulate me to think, and have done a lot of work that has been inspired countless of other physicians and researchers and nutritionists. And I do think that we are at a turning point. But as Dr. Campbell actually said, we still have a long way to go. I'm going to put a little plug in for his book, because I wrote a little ditty for it. If you ever want to hear from the point of view of somebody who's been through the battles of nutrition, read his book, The Future of Nutrition. It's excellent. It's got his characteristic wit. It tells us something about the history that we've been through, and it also sets the tone for the future. And I think that future does involve a grassroots movement. And I would just end by saying that, look, I'm a physician as well as a biologist. And when it comes to food and health, it's not just about the food. We've asked about the avocado and the green juice and about one thing or another. It's actually not only about the food, it's about how our body responds to what we put inside it. When we put something good inside it, it's going to respond well. When we put something bad inside it, it's going to respond in ways that are not so good. And so to that end, we need to actually pay attention and respect our body more. And I think that's where health is ultimately going to start from the inside out, not just from the outside in. Thank you.